Hart, a clinical psychologist and the Chief of Behavioral Medicine at Adapt Integrated Healthcare. With my background working in large county hospitals, children's hospitals, and VA medical centers, I've had the opportunity to develop extensive expertise in integrating medical and behavioral health services. I brought that experience to Adapt, where for the past decade, I've focused on better integrating our medical and behavioral health services to improve care for individuals receiving primary care. Today, I'm excited to talk to you about one of those great innovations, our primary care behavioral health program. To start, let's define integrated care. At its core, integrated care is when primary care and behavioral health providers work together to offer patient-focused care in a coordinated and cost-effective way. This care may address mental health, substance abuse conditions, health behaviors, including their contribution to chronic medical illnesses, life stressors and crises, stress-related physical symptoms, and ineffective patterns of healthcare utilization. More simply, we provide team-based care to increase access to behavioral health care, including treatment for mental health and substance use disorders, and help address the wide-ranging factors that contribute to living a healthy life. Care begins at the very first medical visit when our behavioral health clinicians, also called BHCs, meet new patients and work to normalize seeking treatment for behavioral health concerns. We also want to ensure that every patient has the support they need to successfully navigate an often complex healthcare system. All primary care patients receive annual screenings to identify symptoms such as anxiety or depression that could be impacting their physical health or their ability to implement the treatment options prescribed by the primary care provider. Our BHCs work closely with the patient and their PCP to craft a treatment plan that works for them, utilizing evidence-based brief interventions. Examples of this include cognitive behavioral therapy for insomnia or chronic pain, evidence-based interventions for PTSD, support for tobacco cessation, and solution-focused therapy for acute stressors. Our BHCs work to support the overall health of all primary care patients, often working with individuals over the course of their time with primary care. When a higher level of intervention is needed, we work to connect patients with specialty mental health care elsewhere within Adapt or in the community. Integrated care services include other supports as well. Some examples of this are case management, psychosocial support for patients receiving medications for opioid use disorder, and group interventions that are focused on improving functioning. Our integrated behavioral health team is responsible for connecting patients with resources to support their health, such as help finding housing or participation in the local VeggieRx program. Some of the groups offered provide essential psychosocial support that improves health outcomes. Each of our team members, BHCs and case managers, is committed to improving patient care and quality of life for all primary care patients through immediate access to intervention and support for any behavioral health impact on their overall health. Through this collaboration between medical and behavioral health, we are able to provide holistic patient care that addresses all aspects of a patient's well-being. Focused interventions allow us to have the capacity to regularly reach over a third of our primary care patients for behavioral health support and to remain responsive to concerns shared by primary care providers. Adapt's integrated behavioral health team is an essential part of providing comprehensive, coordinated, and compassionate primary care to our patients. Remember, if you or someone you know ever need us, we're just a phone call away at 541-492-4550 for our Winston Primary Care Clinic or 541-440-3500 for our Roseburg Primary Care Clinic.
To learn even more about Adapt Integrated Healthcare and all the service teams ready to help you and those you love, visit adaptoregon.org or follow us at Adapt Oregon on social media. We look forward to welcoming you soon.